Quarter 1, Module 4, Understanding of Mental Health and Psychological Well-Being. Objectives. Number 1, to interpret the concepts of mental health and psychological well-being in everyday observations about mental health problems during adolescence. Number 2, to identify your own vulnerabilities. And number 3, to create a plan to stay mentally healthy during adolescence. Before we proceed, let us have an activity entitled Fact or Fiction. Read out each statement and tell whether it is fact or fiction. One person in every 100 persons develops schizophrenia. A person who has one or both parents with mental illness is more likely to develop mental health. Mental health is contagious. Mental illness tends to begin during adolescence. Poor parenting causes schizophrenia. Illegal drug use causes mental illness. Mental illness can be cured with willpower. People with mental illness never get better. People with mental illness tend to be violent. All homeless people are mentally ill. Developmental disabilities are a form of mental illness. Poor people are more likely to have mental illness than those who are not. You may stop the video and have more time to answer the activity. Then you can resume after you have answered it. Let us find out if your answers are correct. Number 1. One person in every 100 persons develops schizophrenia. The answer is fact. It is true because only 1% of the general population develops schizophrenia. Number 2. A person who has one or both parents with mental illness is more likely to develop mental health. This statement is a fact. This is true because mental illness can be hereditary. For example, the rate of schizophrenia in the general population is 1%. This rate rises to 8% if one parent has the disorder and to 37 to 46% if both parents have it. 1 in 10 people in the general population has experienced depression compared to 1 in 4 for people whose parents have experienced depression. Number 3, mental illness is contagious. This statement is a fiction, which means that it is false. Mental illness is not contagious. Heredity can, and often does, play a factor in the development of the disease. Number 4, mental illness tends to begin during adolescence. This statement is a fact. The first episode of a mental illness often occurs between the ages of 15 and 30 years. Early intervention is currently thought to be one of the most important factors related to recovery from mental illness. Embarrassment, fear, peer pressure, and stigma often prevent young people from seeking out help. Number 5. Poor parenting causes schizophrenia. This statement is a fiction. It is false. Childhood abuse or neglect does not cause mental illnesses such as schizophrenia. However, stressful or abusive environments may seriously impair a person's ability to cope with and later manage the illness. Number six, illegal drug use causes mental illness. This statement is both a fact and a fiction. Why? Alcohol and other drugs sometimes play a role in the development of some symptoms and disorders, but do not usually cause the illness. However, long-term drug and alcohol use can lead to the development of drug-induced psychosis, which has many of the same symptoms of organic mental illness. Alcohol and drugs are often used as a means to cope with the illness, although using alcohol and drugs can make the symptoms of mental illness worse. Number seven, mental illness can be cured with willpower. This statement is also a fiction. Mental illness is associated with chemical imbalances in the brain and requires a comprehensive treatment plan. Number 8. People with mental illness never get better. This statement is a fiction. It is false because, with the right kind of help, many people with a mental illness do recover and go on to lead healthy, productive, and satisfying lives. While the illness may not go away, the symptoms associated with it can be controlled. This usually allows the person to regain normal functioning. Medication, counseling, and psychosocial rehabilitation are treatment options that can help people recover from mental illness. Number 9. People with mental illness tend to be violent. This statement is also a fiction. People who experience a mental illness acutely sometimes behave very differently from people who do not. While some of their behaviors may seem bizarre, people with mental illness are not more violent than the rest of the population. Number 10. All homeless people are mentally ill. This statement is also a fiction. Although studies have shown that between 17 and 70% of people who are homeless have mental illnesses, it is clear that being homeless doesn't automatically indicate a mental illness. Number 11. Developmental disabilities are a form of mental illness. This statement is also a fiction. Mental illness is often confused with developmental disabilities, even though the two conditions are quite different. Mental illness does not affect an individual's intellectual capacity, whereas developmental disabilities do. However, people with developmental disabilities are more susceptible to developing mental illness. Number 12. Poor people are more likely to have mental illness than those who are not. This statement is a fiction. Income is not a factor in overall rates of mental health problems. However, people with lower incomes experience slightly higher rates of depression. People who live with major mental illnesses often end up in lower social classes because the illness may interfere with their ability to hold a job. Does the previous activity change your mind about mental health? Mental health. It's the way your thoughts, feelings, and behaviors affect your life. Good mental health leads to positive self image and, in turn, satisfying relationships with friends and others. Having good mental health helps you make good decisions and deal with life challenges at home, work, or school. It is not uncommon for teenagers to develop problems with their mental health. Problems can range from mild to severe and can include depression, anxiety, body esteem issues, and suicide, among others. Unfortunately, most young people with mental health problems don't get any treatment for them. Research shows that effective treatments are available that can help members of all racial, ethnic, and cultural groups. If you broke your leg or came down with pneumonia, you wouldn't let it go untreated. Often, however, young people ignore mental health problems thinking they will snap out of it or that they are something to be ashamed of. That kind of thinking prevents people from getting the help they need. Sometimes getting help is a matter of understanding mental health issues and changing your mind about them.